Hello, my name is Dr. Todd Austin from Austin Family Chiropractic in Verdon, Illinois, and I am the team chiropractic physician for the Springfield Foxes semi-pro football team, and I also help out as a team trainer for the team as well. This is my third season with them, and the reason I'm doing this video is to share with you the pattern that I do using leukotape for a severe hamstring muscle strain or sprain. So what I have found from my experience, if a player comes to me with a mild to even mild to moderate hamstring sprain strain, that's something that we can use kinesiotape on effectively. But if the pain level is above a 5, from a scale of 1 to 10, 1 being hardly any pain at all, 10 being terrible pain, if it's much above a 5, we really need to use the leukotape instead, because the kinesiotape, from my experience, really just does not get the job done if that's the case. Now, we can also have some cases where we have even a mild or moderately torn hamstring, and this leukotape job will be effective as well. So as a team trainer, it's my job to get these guys back in the game so they can play without any pain and where they can be as close to 100% productive as possible while they're in there. So that's why we do this leukotape job. So I've got a couple YouTube videos that I shot recently. One was of doing a leukotape job on a patient in the clinic. Another was doing a leukotape job on the same patient on the sidelines just before a game. So I'm going to show you what materials I use. First of all, before I would leukotape a patient, they're going to tell me where it hurts. I'm going to put an X on that spot so I know exactly where the complaint is. The first thing I'm going to do is actually use some of my Springfield Foxes cold laser therapy devices on that area first to decrease inflammation, pain, swelling, edema, and help increase that damaged tissue's ability to handle additional stress. So that's the first order of business for me, is using some cold laser therapy. The second order of business after that is to go ahead and do the leukotape. The first item we need is what I use is a Tough Skin, but there's other companies that have similar products out there. It's like a pre-spray, so it'll make the tape hold better. That's the first thing I'm going to use. Then I'm going to use the cover roll, which goes underneath the leukotape. It's just a white tape here. The third thing I'm going to use is the actual leukotape, or leukotape P, which is this brown tape. And then the final thing we're going to do, which is after the game, because unlike kinesiotape where we can leave it on 3 or 4 days, we would not want to do that with leukotape. We don't want to sleep in the leukotape. We want to take it off before the person goes to bed that night. So what happens in our situation, my wife is also one of the trainers and a massage therapist. Eugenia usually takes this off the players on the sidelines after the game, after they're done playing. If she does, she uses this, the tape remover, which helps it come off easier. It is kind of hard to get off on most occasions. It's not unusual that we have to have these guys put a towel in their mouth while she's taking it off of them. But this is what she uses. Now, if for some reason they want to go home and then take it off later, we just make sure to send some of this tape remover home with them so that they can get it off there once they arrive at their destination. So that is my little introduction to my videos about leukotaping a torn or severely sprained hamstring muscle. Thank you for watching.